I just turned on the recording. So this is the first question because, Olympics are going around. So who can tell me what's the fastest sports in the world?
Badminton.
Who is this person?
Bilal.
Ah, Bilal, you already knew the answer. So that's a bit unfair with other people. But anyway, it's one of my picture after winning one of the Victorian mixed doubles. So the badminton, that's right. Badminton is the fastest sports in the world. And you can see the speed of the shuttlecock, fastest smash, which is 565 kilometers. Actually, I had it 470 kilometers. And when I was doing this presentation, I just found out that someone has made a new world record of 565 kilometers an hour. So that was a bit of an addition to my knowledge. Is someone trying to say something, or you've forgotten to mute your mic?
I think please mute your mics.
All right. So let's move on. So my presentation, this is the format I have got today for my presentation. Sadia, could you please mute your mic? Thank you. So we'll have the discussion about ADHD assessment and management. Our main, chunk of our today's discussion would be around, stimulants and how we can co-manage with the GPs. And then, I have various polls during my presentation. So what I'll do is I'll paste the links for the polls when I ask the question in the chat. What I request you guys is to click that link and answer the question. And I'll keep showing you the results of that poll just to make it interactive, because otherwise, it's very difficult to engage you guys while we're doing these presentations online. So that's why I've just designed some polls. And at the end, we'll have 5 or 10 minutes of question and discussion session. So these are our learning goals. So hopefully by the end of today's session, we'll try to achieve most of these goals, or hopefully all of them. I think you guys might be aware already that ADHD is one of the leading presentation to general pediatric medicine. And as you can see, its incidence is very, very high. 1 out of 20 kids in Australia currently are diagnosed with ADHD. So our first poll for the day: which one is the most definite diagnostic test for ADHD? You guys can click the link and start answering. I'll show you the results on the screen. Tell me if you guys have trouble clicking the link.
Dr. Wasim, just wondering where exactly the link is. Sorry to
in the chat box. Just okay. on the Zoom chat.
Yeah, just found it. Thanks.
I hope you can see the screen of the poll. I've just shared the different screen now. Can Dr. Majid, could you please confirm you can see the poll screen on your side?
Yes, we can see.
Okay. No one has answered yet. I can't see the
it doesn't allow to.
I did actually.
Oh, it's coming up now. Yes.
Here you go.
Coming up. Excellent. Okay, so we have got 33 votes. As you can see, majority thinks that genetic testing is the most reliable diagnostic test for ADHD diagnosis. Unfortunately, the answer is not correct because ADHD doesn't have any diagnostic test at all. So this is a clinical diagnosis, and there is no definite test available to diagnose ADHD. It was just to wake you up, all of you, so that you don't go to sleep. So there are various contributing factors which we need to consider. There is genetic predisposition, because if the parents have ADHD, the children are at a higher risk of having ADHD. So it is genetically transmitted. The other contributing factors, as you can see on your screen, are complex psychosocial situation, excessive screen time. I'm really a big advocate of reducing the screen time, because it just stimulates the brain too much. The kids may have hearing issues associated with this, autism spectrum disorder, parental mental health issues, poor routines, poor dietary choices. So these are the contributing factors for ADHD. Now, commonly in our practice, the kids who are referred for ADHD assessment, so these are the two categories. So usually, under the age of 5, we see the kids referred to us with a significant behavioral challenges where parents are failing to cope managing their behavior, and they're worried about their significant energy levels, and they are difficult to manage at home. Kids over the age of 5, I think majority of them who come to us and referred by you guys are the ones who are struggling at school. So their main problem is their learning difficulties, and they're not meeting expected levels at school. That's why they're referred. Of course, they will have associated, difficulties of poor concentration and, hyperactivity. LD is for learning difficulties. Now, who can do this assessment? And as you guys know, under the age of 18, they are considered pediatric population, so they come to us. And we do the assessment. Now, the confusing part is a large number of kids are diagnosed with psychologists under the age of 18 as well. Now, it's a little bit of a gray area whether we agree with that psychologist assessment or not, because essentially pediatricians are the ones who have authority to prescribe the medications. So many a times we may have to go through the history and observation ourselves to agree or disagree with that diagnosis. So we may not agree 100% with the psychologist assessment. Psychologists usually use Connor rating scale, which a lot of pediatricians, they think it's not a very sensitive tool in terms of assessing ADHD. Over the age of 18, obviously, as you can see, and we have got Usman with us, so probably he will explain better to you guys. Now, the tools we use to assess ADHD is, as I said, it's a clinical diagnosis. It's based on history, observation, school reports, Vanderbilt questionnaire. So a vast majority of pediatricians around Victoria, and I have traveled around Australia as well. I think majority of pediatricians, they rely and they think Vanderbilt questionnaire is the most sensitive tool, and it is reliable. The important thing to understand is when we are talking about ADHD, we are talking about a disorder, and we are saying that a disorder should be present in more than one environment because it's a disorder. So it shouldn't be only, the difficulties should not only be present in one environment, because a lot of time parents will come and they say, we have this challenges, but when you ask the report to be completed in another environment, the difficulties may not be present there at all, so they don't meet the criteria for diagnosis. That is the reason these questionnaires, whether Vanderbilt or Connor scale, they are always failed in more than one environment. So we ask them to get it completed by the classroom teacher as well as by the parents. Now, the next poll I'm going to ask you guys, what's the minimum age we can make a diagnosis of ADHD? And I'm just pasting this link on your screen, and I'll show you the results of the poll on your screen. All right. So at the moment, I can see a lot of people are voting for an age of 5 years. There are 20% of people who believe it could be 3 or 4, and 5% of people have responded that it can be diagnosed at an age of 2. Any other voters, or should I move on? All right. So let's move back to our presentation. So the answer is that we cannot make a diagnosis below the age of 5. So the people who have voted for 5, that is the correct answer. That's the minimum age. Although if you look at the PBS prescription criteria, the minimum age we can prescribe the stimulants, that is 6 years. So because it allows pediatrician to prescribe between the age of 6 and 18. The diagnosis we can make minimum at an age of 5. Now, this could be quite challenging for some parents because they will come and say, we are unable to cope with this child, although it's 3 years of age or 4 years of age. But the idea is that they're not mature enough and they may not have enough exposure to the external environment to make a call whether they meet the diagnosis. And hence, PBS does not allow us to prescribe stimulants below the age of 6 on PBS. There are exceptions where we prescribe stimulant medications after the age of 5 as well. That would be non-PBS, but we can still prescribe it. And these are the extreme cases where, for example, a child has already started attending school, they are in grade prep, and they have significant challenges with their learning, or they are extremely difficult to be managed at home or school environment. At the same time, there are kids who are under the age of 5, but they have significant challenges for the parents and cannot be managed at their kinder or childcare to the point that, parents are going crazy. And in those exceptional situations, although they will not meet the criteria for ADHD, we may be able to consider prescribing some medications to calm them down, although they are not the candidate for stimulant medications. Henyon, HNYNN, could you please mute your mic? Thank you. All right. So that's just a brief, idea about, the assessment and, the age groups for your understanding. And I think you guys already, because you guys make the referral, you're pretty much well tuned with this. So let's move on to our next section, which is the management options. I think that the one important thing, and this is what I think setting up the expectation for the parents as well, that rarely in a pediatrician would be in a position to start medications on first appointment. And as you know, many a times these parents are coming after getting a diagnosis from a psychologist. And they're very keen, they will ask for, an appointment with the pediatrician, and straight away they want us to prescribe the stimulant medications. And pediatricians rarely would prescribe it after the first appointment without confirming and, observing the child a couple of times. Now, the option number 1 in terms of management is, managing ADHD without drugs. And usually this decision is made in discussion with the parents. Also, this is also based how significantly this child's learning is being affected and the parental life is being affected. So these are the 2 or 3 major factors involved in making the decision. Of course, I mean, the medical conditions may also come and play some role in terms of whether they are the true candidates for starting the medications or not. So just to remember, I've divided it into, 4 H's and 2 P's. It's not documented anywhere in the books, but this is self devised by myself, really. So healthy eating, avoiding a lot of sugary stuff, healthy sleeping, healthy physical activity. So generally, in my personal experience and suggestion, I always ask them to be engaged in at least 2 physical activities. One of them should be like a team sports activity where, in these activities, they have an opportunity to channelize their energy and also socially engage with other people. Healthy screen time. So there is no black and white number, but generally, we say the recreational screen time. I'm not talking about academic screen time because, a lot of kids will be doing their learning and schoolwork on the devices. I'm talking about the recreational screen time, and my general suggestions are it should be less than 2 hours a day. 2 Ps. So obviously, there are a lot of psychologists around us who specialize in ADHD, and they are able to teach some strategies, how these children can improve their impulsivity, how they can manage their, hyperactivity, and how they can help around improving their concentration levels. And in my personal experience, the team sports and physical activities itself, that is a big game changer, and helps these children, improving their focus and their concentration, because that's a natural training when they're engaged in the sports to improve their concentration. Positive reinforcement. I usually, stress a lot about this during my consultation, asking parents to implement, star charts. And, at the end of the week, for example, they can buy some reward with these stars when they're behaving positively, listening, completing their work, completing their tasks before they move on to the next task, kind of thing. So this is like a general guide in terms of managing without drugs. The other things which we can help, there should be like a routine and a structure in their work, in their daily activities and a day-to-day life. We can request school to, do individualized learning plans where, they have, they can help breaking down the task for these kids into smaller tasks. And that is really helpful. We suggest that these kids should be seated in the front, which would help, their engagement with the teacher and classroom activities. I've copied a link here, but you can Google it yourself. That's the RCH website, where, we can also quite a few resources, how these kids could be helped in the school environment and home environment with the ADHD difficulties. Now, the second management option is, all of the above things included, plus adding drugs. And again, while drugs are being used very, very frequently in Australia at the moment, this is a decision which is not very easily made. I think someone is talking in the background. Could you please mute your mic? I'm not sure. Aruj Fatma, could you please mute your mic?
You can voice.
I don't know. I'll try. Aruj Fatma, I can't find her. Oh, she has muted it now. Thank you.
Thank you.
So the decision of drugs is not taken an easy decision, and parents really need to have an informed consent and informed decision to go forward in the direction of drugs, because the drugs come with significant side effects. The drugs are of 2 types, as you guys are aware. One group of the drugs is stimulants, which is the most popular group. And I think you guys are very well familiar with these drugs. Less commonly used, but I'm a big fan of other group, which is a non-stimulant group. And I use this very frequently in my day-to-day practice as compared to stimulants. And there are significant advantages of doing that. And that's the reason I do that. I'll explain that in a second. In terms of stimulants, I think you guys are very well aware with all of these drugs. Most commonly used drug is Ritalin, which comes in two different forms, short-acting and long-acting. So short-acting lasts for 4 hours. So it has to be taken twice a day to cover the school, 8 hours of the school. And so 6 hours of school, so 9 o'clock to 3 o'clock, but generally, they take it at breakfast time and then they take it at midday. So it covers them for 8 hours time. In comparison, the other longer acting form is Concerta, which we think it lasts anywhere between 8 to 10 hours time. So it's again just to be taken once. So Ritalin itself comes in two forms, short acting and longer acting, and Concerta itself only is a longer acting form. Then you have heard about dexamphetamine and Vyvanse. These are the other drugs, which are single daily dosage most of the times, which are used as an alternative. So most of the pediatricians or the other people who deal with ADHD, they will try, they can start from one end and they'll go to the other end, whatever way they are more trained and comfortable and they are aware of all the side effects and monitoring. I generally, if parents are keen to go on stimulants, like many other pediatricians, I generally start with Ritalin. But there is no right or wrong answer. So nobody can. So generally, if you go on the PBS, the criteria is that we should try a short-acting stimulant first before we can prescribe the longer-acting form. So that's just a PBS criteria. Okay, let's move on to our next poll. And you can see your screen here. The question is, are these stimulants addictive? Did you get did you get the link? All right, people have started answering. Let's see. So 63% of people think that they are addictive. And 37% of people. I encourage you all to answer these polls so that I make sure you guys are engaged and not sleeping, except the ones who may be driving at the moment. I understand some of you guys have finished just work. But it's just an excellent way of engaging for this, workshop today, that you are answering these questions. Now, let's go back to our presentation. And yes, these drugs are not addictive. So it's a myth, where, people believe that stimulants are addictive. So these medicines can be stopped anytime. They don't need to be weaned off, that they are not addictive. And generally, we tell parents that you can give them a day off on the weekends or during school holidays. If parents want to give them a break, they don't need to take these medications, and it can be restarted during school days, because the ultimate purpose of these medications is to improve their learning if parents are able to cope with their behavior in the home environment. I think you guys are very well aware of the side effects of stimulants. I think that the biggest problem of the stimulants is it affects their growth by reducing the appetite. So that is the most challenging aspects, and many times we have to stop or reduce the dose of stimulants. Other things, I think, in terms of the long-term monitoring, blood pressure and heart rate, the stimulants can cause hypertension and slight tachycardia. And it can affect their height as well. So these are the three ongoing problems alongside the sleep challenges, which need to be continued monitoring. Sleep is easy to be dealt with. We start them on maybe melatonin or something to help with sleep, but other two things require ongoing monitoring. And if they are dropping their centiles, or they are tachycardic significantly or hypertensive, we have to review the medications, and sometimes we refer them to cardiologists to make sure they don't have any underlying cardiac condition. The other side effects which are listed here, they are all very short-lived side effects. and they are usually present only in the initial days after starting the medication. Usually when the body gets used to it, these side effects will settle down in a couple of weeks time, 2-3 weeks time, like stomach aches or nausea or, irritability or being a bit of emotionality. Okay, so let's move on to our next poll. And again, I will encourage you all to engage and respond to these polls, which is an excellent way to be involved with the presentation. So I'll see what you guys think. All right. So 20 people have responded and 85% of you guys believe that you can prescribe stimulants with approval. I think a few other people have chosen different options. Yes, I think the majority at this question is correct. You guys can all prescribe stimulants with an approval. And my understanding is that you need a letter from a pediatrician or specialist who is dealing with that. And if you understand the side effects and you're happy to monitor those side effects, you guys should be able to prescribe and monitor. And this is my biggest initiative always, and especially for today's presentation to enable and equip you guys, that I would strongly encourage you after today's presentation that you guys should co-manage these stimulants, and you should be able to prescribe these stimulants after today's presentation, because you just have to monitor these side effects. That's the main thing. If you have any challenges, always, continue communicating with your pediatrician. It will take significant workload and burden from the pediatricians if you guys are happy and start feeling comfortable to co-manage these patients, because it is not easy for the specialist to bring these kids back just for the sake of giving them a repeat script, because the waiting times for pediatricians and other specialties, it's significantly high. Non-stimulants. I know Dr. Majid is getting a bit restless with the timing. How are we going with the timing, Dr. Majid?
I think we are all right here.
We're all right. Okay, so we are progressing quite well, actually. We have covered a lot already. In terms of non-stimulants, we have got few options: Strattera, clonidine, and Intuniv. I think you guys must have seen Intuniv being used quite frequently amongst the non-stimulants. Not one of my favorite, but I think my favorite drug here is clonidine, which is a superb drug. Works perfectly well, especially for the emotional challenges and behavioral dysregulations. It's an excellent drug with minimal side effects, and it's very easily titratable. So I use this drug a lot in the kids who don't meet the criteria for ADHD, or the ones who are under the age of being diagnosed with ADHD, if there are significant challenges. Even with the ones who have been diagnosed with ADHD, if the major complaint from the parents is their behavioral dysregulation, I give them an option to start with clonidine because it's an excellent drug. It also helps improving their sleep, which, that's why this is just the majorly I've mentioned clonidine side effect here. So it can cause, as you guys know, you might have seen this drug being used for hypertension. So it can lead to some hypertension. So we need to keep an eye on their blood pressure. If they're having syncope or pre-syncope, those kind of things, we might need to stop the medication or reduce the dose. In some kids, it increases the appetite, and it's an excellent drug. We only sometimes just use for sleep issues, because if melatonin is not working in these kids, I start them on clonidine, and they will come back and tell you now their sleep is excellent. Okay, now, what do you guys think? Can GPs prescribe non-stimulants? So that's our next poll. If you guys can please answer. I think we're just getting a little bit short on time. So quickly, if you can answer. Okay, so Only 6 votes. I'm waiting for some more votes, guys. Hurry up. 24 votes. Excellent. Well done. So yes, so people, majority of you have answered yes with majority have you answered yes without approval, and that is the correct answer. You don't need an approval for non-stimulant medication.
Aisha,
As long as you know you are
Aisha,
familiar.
Aisha,
Sorry,
excuse
Naima,
me, still
I'm
here.
just trying to
Wait,
mute Naima. I don't know how to do that. Naima, could you please mute your mic?
still here.
Naima, could you please mute your mic? Thank you. So yes, if you know the side effects, and I'm not saying that we need to know all the books, but just major side effects as I've listed earlier. And the way I have prepared this presentation is to give you guys just the very, very, juicy points rather going into the nitty-gritty of the things, because that's what we need to learn, and that's what we need to work with a specialist. Okay, so have any of you guys heard about this podcast, which is called Attitude? So basically, it's ADD, so attention deficit disorder. So Attitude podcast. So I'll show you this one. It's an excellent resource. You guys can refer parents to this website. There are loads and loads of podcasts they can listen, and they can work with their children how to help improving their difficulties of ADHD. It's an excellent resource. Now, remember, ultimately, we are expecting that these kids will grow, their brain will mature, and we are hoping that they will learn to manage these difficulties with a better thinking and better control of their brain. So they don't need to be necessarily on these medications for the rest of their life. And these are not addictive medications. I'll leave the rest part of this, conversation for Dr. Usman to answer. But from a pediatrician perspective, we are expecting, and a majority of the kids who are under my management, they don't require these medications ongoing. Okay, what about fish oil? Have you guys researched or used this one? What do you guys think? So I'm just gonna share this poll. If you guys can click this one and start answering. You guys can see the poll results. I'm just trying to change the screen. Yes. So I have got 21 voters here, and majority of them, they believe it is helpful. So I've got 28 voters. I'll see if anyone. So 56% believe it's helpful, and 44% believe it is not helpful. So the answer is yes. Some studies have been done around fish oil, and it has proven to be of some help with ADHD. Personally speaking, I have seen a lot of parents using fish oil. I personally have not prescribed, but my experience is very mixed up. But when I look at the studies, and if you look at the RCH website, they have recommendations to try fish oil. So I leave it for you guys to guide parents if they want to choose and they want to try the fish oils. Now, when do we stop these drugs? So the decision is, again, it is based on parental choice, similar to how we started these medications. Parental choice, child choice, teacher's feedback, if the medicines are poorly tolerated, or it's causing significant side effects, especially if the kids are having hypertensive issues and they have underlying cardiac conditions. In the first place, we are always very reluctant to start stimulants if they have any underlying cardiac problems. And we ask cardiologists to give their opinion whether we can start, whether they are suitable to go on these medications. And, if they are mature enough and they say, we are not getting any benefit from this medication anymore, we are already in grade 10 or 11 or whatever, and we want to come off, we say, yes, okay, that's fine. You stop taking it. Now, there's a big overlap, and I wouldn't go into a lot of detail of this because we're running out of time. There's a big overlap of ADHD with these three things, and sometimes it becomes very difficult for us to tease out what is causing what problem. One thing for sure, I have a high tendency to treat anxiety if, there is a significant, I usually use Eckenbeck or Echenbeck, whatever Usman you call it. I use the Eckenbeck questionnaires to assess their well-being status. And again, that's questionnaire done by parents and second part by the young person or by the classroom teacher. The young person can do it if they're above 12 years of age. So I use that one. And if there is a significant concerns about anxiety, I usually treat anxiety with the anxiolytics and their symptoms will get better. They may not need to go on stimulants at all if their symptoms are improved, only just with the treatment of anxiety. Okay, now our last poll for today is, what do you guys think? Whether ADHD is being overdiagnosed or not. I'm going to share the screen for the poll for you guys. If you guys can click and answer, I'll see how many, 33 votes. Oh, pretty good. So, oh no, sorry, I have to choose the different poll. Is that being overdiagnosed? Yes. Okay. So I've got 31 voters and a significant majority of 34 votes believe that ADHD is being overdiagnosed. And yes, I think it's a very controversial topic. As far as it's my individual opinion and experience goes, I agree that ADHD is being overdiagnosed. And the reason behind that is psychologists have got a softer criteria and softer corner to diagnose these people. And on the other end, I think there is another challenge, when these parents are paying $1,000 or $2,000 to psychologists, they want to hear an answer. And I think psychologists are under a lot of pressure that when they're charging this much of money, and many times up to $3,000, then they come up with this diagnosis and they hand it over to them and they say, okay, now you go to pediatrician and to get the stimulants prescribed and your kid will get better. On the other end, parents are pushing really hard. They want their child to improve their academic performance, especially in the higher grades, and they want a diagnosis made. So unfortunately, it is true. And that is the reason a pediatrician, like majority of pediatricians, would never start medication just based on their previous diagnosis made by a psychologist until they are sure that, yes, I have seen this kid, I've observed, I agree with the history or disagree, and that's how they will come to the diagnosis. Okay, so that's the end of my presentation. Take-home messages. Yes, GPs can co-manage, and I will encourage you all after today's workshop or presentation to please put up your hand, co-manage with your pediatrician, ask him to provide you with a letter so that you apply for the approval, whatever is the process. Probably you guys know the process better than me. And you should be able to co-manage it with your GPs, with your pediatricians. Remember that drugs are more helpful in the presence of 4 H's and 2 P's, which I've already mentioned to you guys. Individual drugs may not be able to help for a very longer period of time. So I keep retreating to these parents that please stick to all the other strategies I'm telling you guys. Otherwise, drugs may not be as helpful. The main things, which is the long-standing monitoring, in terms of the long-standing monitoring, is their growth and their blood pressure. All other side effects would gradually get better. And remember, all of them will grow. They are expected to grow, mature up, and get rid of these medications. So that's the end of my presentation. Now, I think Dr. Yusuf and Dr. Majid will mediate in terms of any
How are you?
questions.
Thank you, Dr.
How are
Hosseini. for your wonderful
Morning.
presentation. Can I
Zoom
ask
meeting.
everyone?
Zoom meeting you have
Mm.
now?
Can I ask everyone to please mute their mic?
One of the
Okay, I think I'm like,
The focus
Team,
one?
if you can
oh,
unshare your presentation,
one of the ADHD.
hand over the
I want to know about that.
to Majid.
Oh.
So we can
It's a
mute
kid.
everyone.
Just tell the host, so just mute them, you know.
Finished.
It's over.
I wait until they show me the certificate. What is it?
Can I request everyone please to mute your mic so that we can take the questions?
No. No.
Is there an option to mute everyone together, Dr. Yusuf?
Yes, will be, but with the host.
You are the-
You can mute all of them once. You can
Okay,
mute all
I'm
of them.
just going to mute. I'm just going to mute everyone.
I'm trying just an all praise. I'm not going to eat. You know, I can't eat much. I want to have crispy fried calamari.
All right.
All
Now,
right.
Dr. Yusuf, you can talk. I've muted everyone.
Thank you very much. We only have actually a couple of minutes left. We have our next guest with us. So I'm just going to get a couple of questions. But what I would request, Dr. Majid, that maybe some of these questions we can send to Dr. Wasim and we can then distribute answer through the email later on.
Yep, sure.
All right. So with regard to some of the questions I'm randomly picking up, Eliza would like to know how often do we need to review a child who is on medication already?
Yep. So that's a very good question. So initially, when we are in a trial period, which in my view is different pediatricians have different time, but generally 4 to 8 weeks time, we suggest that they should have this monitoring done once every week. Once we know that they are not getting any significant side effects from these medications and they are stable on a stable dose, because when we initiate this medication, we start from a smaller dose and we reach a target of, for example, 20 milligrams of Ritalin every day. Then we keep them on a stable dose. Then, the monitoring can be gradually reduced to maybe once every 3 weeks, once every month or something like that. So it doesn't need to happen every week. But in the trial phase when we are starting a new medication, once every week. And that's what I write in my letter to all the GPs.
Thank you very much. The next question, Sana would like to know how long you continue short-acting stimulants before you switch to long-acting.
2 months. So all the medications I start, and I think that's all the pediatricians do. I'm not sure about adults, so Usman will guide about that. In terms of all the medications I start in pediatrics, I give it a trial of 2 months so that I then document that this medication has worked or has not worked for this person before I move on to a different agent. So 2 months is the period of like a trial period.
Excellent. And Randy would like to know regarding the fish oil, what should be the dose and what changes should you expect from the patient?
I am the least experienced. I think we just have to follow the directions on the bottle.
No worries. All right. So thank you very much. What we're going to do now is move on to our next segment. And we are very fortunate to have a special guest with us. And this is about the future of RACGP. As most of you, in fact, all of you are fellows of RACGP. We are